What could be more beautiful? What could be more attractive than sitting on a hillside in Greece or Italy, eating a pile of beautiful fresh food with a glass of wine, some olive oil? You know what I'm talking about? I'm talking about the Mediterranean diet. And on top of it being just kind of sexy and wonderful, you could lose weight and reduce your risk of heart attack and stroke by 30 to 40%. Well, the University of New York, or New York University, came out with a study that said 7,400 people were studied. So this is not just some maybe, maybe not. It's a lock. This is a study that proves that the Mediterranean diet, which is considered a higher fat diet than what the American Heart Association has always recommended, which is, cut out fats, they're bad for your heart. That is not true. Bad fats are bad for your heart. Good fats are good for your heart. What are good fats? Walnuts, olive oil, macadamia nut oil, fish oils. There's just a whole list of them, but basically fresh whole foods. Red meat, it's not all bad for you. The marbling in a ribeye is actually good fat. It's called beta-sitosterol. But any fat around the edges is kind of bad fat, and it can cause all sorts of problems in your heart and stroke risk. So the Mediterranean diet, it's basically grains, nuts, fresh vegetables, and in this study, they allowed people to have a glass of wine per day. I'm not recommending it for everybody. I don't think it's a good choice for everybody, but probably if you don't have a problem with drinking, then having a glass of wine, 3 to 4 ounces, probably red wine's better than white, once a day is probably okay. Men don't ever want to exceed 2, women never exceed 1, 3 or 4 ounce glass. And the Mediterranean diet has been shown to help people lose weight, reduce the risk of heart attack and stroke, and be wonderful. It's not some unpleasant, I can't ever eat any fat diet. So you're probably a candidate to try the Mediterranean diet. Get with your doctor, make sure it's okay. I can't imagine there's many people who it's not okay with. Get with your doctor because we're better together.